Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and the Gynecology Faculty of Medicine, Mansoura University. Today, I have a case scenario discussion with you about a pregnant patient with concerning symptoms of infection. Okay, so this is our objective today. Let us start this case scenario and try to think to reach the diagnosis. Okay, 25-year-old prime gravida woman at 27 weeks gestation was admitted to hospital for medical evaluation because of a 3-day history of low-grade fever, 38.2 degree, chills, malaise, myalgia, nausea, diarrhea, abdominal and back pain, and intermittent uterine contractions. Her symptoms began one day after she and her husband had a dinner at a local restaurant. She specifically recalls eating unpasteurized cheese. Her husband also is experiencing similar symptoms. She has no other medical diseases. So, we have today a case scenario of a 25-year-old prime gravida woman. Her gestational age is 27 weeks. She is complaining of low-grade fever, chills, malaise, myalgia, nausea, diarrhea, abdominal pain, back pain, intermittent uterine contractions. These symptoms developed one day after she had a dinner in a restaurant with her husband, and she remembered that she ate unpasteurized cheese in this restaurant. Her husband has similar symptoms like her. So, this is the case. Try to think about it to reach the diagnosis. Then we need to answer, what is the most likely diagnosis? Also, what are the investigations needed to confirm the diagnosis? What are the possible maternal and fetal risks? How should this patient be managed after you reach the diagnosis? Lastly, what are the conservative measures for prevention of such infection? Okay, so let us start with the first question here. What is the most likely diagnosis? I think it is clear enough that this is a food-borne infection, right? The most likely diagnosis in this patient is listeriosis. And listeriosis is caused by Listeria monocytogenes, which is a gram-positive non-spore-forming bacillus. As you see here in this picture, gram-positive non-spore-forming bacillus. Listeria monocytogenes. And listeriosis, a potentially serious food-borne illness. The primary reservoir of listeria is soil and decaying vegetable matter. The organism also has been isolated from animal feed, water, sewage, and many animal species. Okay, everybody? Okay. Foods that pose particular risk of transmitting infection include fresh unpasteurized cheeses, like this picture, fresh unpasteurized cheeses, processed meats such as hot dogs, refrigerated pate, and meat spreads, as in this picture, this is meat spreads, refrigerated smoked seafood, unpasteurized milk, and unwashed raw produce. Okay, so these foods or types of food that may lead to risk of transmitting Listeria monocytogenes. Also, melon and hummus, also other foods that can transmit infection. So this organism is present in soil and decayed vegetable matter and in some animal species. What are the investigations needed to confirm the diagnosis? The first investigation you should do is blood culture and gram stain. This is the ideal. And the gram stain typically will show gram-positive polymorphic roots with rounded ends. Amniocentesis may be performed if the patient has sepsis, and the amniotic fluid should be cultured for the microorganism. Meconium staining of the amniotic fluid and the positive gram stain are highly indicative of fetal infection. And this is, of course, has a dangerous on the fetus. Culture of cerebrospinal fluid are indicated in any individual with focal neurological findings. So, if we have a case with neurological symptoms, such as symptoms of meningitis, encephalitis, and so on, we should do CSF culture. But in our case today, we have no neurological symptoms. So quite enough for us to do blood culture and the gram stain. And if there is persistent symptoms or symptoms of sepsis, or severity of symptoms, we should do amniotic fluid sampling and amniotic fluid culture and the gram stain also. Okay? But the most important investigation in our case today is to do blood culture and the gram stain. Is in our case we need a stool culture? No. It's rarely indicated, stool culture. Okay? I hope it is clear enough. CSF culture may be needed if there is neurological symptoms. Okay. What are the possible maternal and fetal risks? Maternal risks vary from mild gastroenteritis or moderate or severe up to severe meningitis, encephalitis, and so on, and septicemia and sepsis. Okay? That may be life-threatening and they may cause even death if neglected. What about fetal complication? There may be IUGR, fetal death, preterm labor and the delivery, neonatal sepsis, early or late neonatal sepsis, meningitis, and the death. This is as regard the maternal and the fetal risks. So we should take it seriously and manage the patient properly. So how should this patient be managed? As I said before, I'll do blood culture for the woman and the gram stain. If mother appears septic, obtain amniotic fluid and do gram stain and the culture. If CNS symptoms are present, perform lumbar puncture to have CSF culture. Hospitalize and treat with intravenous ampicillin 2 grams every 4 hours. Then look for the result of the culture. So you started with 2 grams ampicillin intravenous every 4 hours, waiting for the result of the culture. If it is negative, complete 7-day course of therapy with oral amoxicillin 500 milligrams 3 times daily. But if the blood culture is positive, continue intravenous treatment for 14 days. So, if blood culture is positive, I should continue the intravenous treatment for 14 days with ampicillin. What if the woman has an allergy to penicillin? The alternative drug for Listeria monocytogenes is trimethoprim sulfamethoxazole, 10 milligram per kilogram per day in 2 divided doses for 14 days. Okay, after we started the treatment properly, do serial ultrasound examination to monitor the fetal growth, any CNS anomaly, placental morphology, amniotic fluid volume, umbilical artery Doppler velocimetry. Okay, what if the patient, like our patient today, we are talking about a woman has intermittent uterine contractions, so I should do BV examination to evaluate cervical dilatation and if there is progressive cervical dilatation or not, because the patient may have a risk of preterm labor or already in a preterm labor. Okay, what else in management? If there is fetal growth restriction, oligohydramnios, abnormal Doppler velocimetry, please do biophysical profile test. Okay. What about after delivery? What you are going to do? After delivery, of course, the baby needs special care by the pediatrician, and you should examine the placenta carefully for histological evidence of Listeria infection, such as miliary abscess and the culture for the bacteria. Lastly, what are the conservative measures for prevention of such infection? We know that prevention is highly important. How to prevent such infection with Listeria monocytogenes? Okay, some advice. Please do the following. Refrigerate milk and the milk products at 4.4 degrees centigrade. Don't consume any beverages or food made from unpasteurized milk, like unpasteurized cheese. Okay? Thoroughly cook raw food from animal sources. Wash raw vegetables carefully before eating. Keep uncooked meats separate from cooked meat and vegetables. So don't mix the uncooked meat with the cooked one, or uncooked meats with the cooked vegetables. Okay? So you should separate both of them. Okay. After handling uncooked food, carefully wash all utensils and hands. Avoid all soft cheeses, such as Mexican-style feta, brie, camembert, and blue cheese, even if they are supposedly made from pasteurized milk. Please reheat until steaming hot all leftover foods or ready-to-eat foods, such as hot dogs. Don't let juice from hot dogs or lunch meat packages drip onto other foods, utensils, or food preparation surfaces. Please don't store opened hot dog packages in the refrigerator for more than 1 week. Don't store unopened package for longer than 2 weeks. Please don't store an opened lunch and deli meat package in the refrigerator for longer than 2 weeks. And also don't store opened packages for longer than 3 to 5 days. If other immunosuppressive conditions are present in combination with pregnancy, thoroughly heat cold cuts before eating. Please don't eat raw or even lightly cooked sprouts of any kind. Cook sprouts thoroughly. Rinsing sprouts will not remove Listeria organisms. So just rinsing sprouts will not remove Listeria organism. So you should cook sprouts thoroughly. Please don't eat refrigerated pâté or meat spreads from a deli counter of the refrigerated section of a grocery store. Canned or shelf-stable pâté and the meat spreads are safe to eat, but be sure to refrigerate them after opening the package. Lastly, don't eat refrigerated smoked seafoods. This is the end of our case scenario discussion today about Listeria monocytogen infection with pregnancy. I hope it was clear enough for you. This is my scientific sites on Amazon, where you can find my books here: textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and gynecologic oncology book. And this is my site on YouTube channel, where you can find more lectures in OB Guide. And this is another scientific site belong to me on blogspot.com. My best wishes for all of you. Thank you, everybody.